Hi, it's Doctors Jennifer and Scott Waddell. Today we want to talk to you about the importance of vitamin D and its role in your health, but more importantly on your immune system. So vitamin D is actually not a vitamin, it's a pro-hormone steroid that's essential. It's an essential nutrient for your body. And recent studies show that it has a major impact on DNA synthesis, cell differentiation, immune reactions, mood stability, and cognitive health. So how does vitamin D form in the body? Because we manufacture it through exposure to UV rays. When the UV rays interact with the skin, it creates a pre-vitamin D, and this fat-soluble metabolite then is activated through complex processes through both the liver and the kidneys. This vitamin D is then metabolized into the bioactive form, which your body can use for all these different processes, and that's vitamin D3.
You know, vitamin D is such an essential part of our physiology. We need it in so many processes in our body. It's shocking to realize that it's estimated between 70 and 80% of the population is actually deficient in it. And so we know vitamin D's role in over 300 different diseases and different processes. And we know that there's 300 different illnesses that can be activated and triggered when we are deficient in vitamin D, including things like flu and colds, including pneumonia, infections, autoimmune diseases, cancer, cardiovascular issues, type 2 diabetes, bone loss. It increases our risk of something called ARDS, which is acute respiratory distress syndrome, and also neurological issues. And if you're wondering if you might be deficient in vitamin D, here's how that might show up in your body. You might have issues with sleep. Sleep changes, your sleep cycle changes. You might notice increasing levels of fatigue, pale skin with dark circles under your eyes, increasing infections coming more frequently, frequent coughs and colds. Your muscle strength might be diminished, weak and aching bones. You might notice mood changes, low mood and depression kinds of feelings. You may notice an increase in back pain, and you also may notice a loss of appetite. All of these are indications that you might be one of the 70 to 80% of the population that has deficient vitamin D.
So why are we at risk for low vitamin Ds? Well, one of the reasons is a lack of sun in the winter months. So studies show that people in the wintertime in the northern hemisphere, the farther north you go, the lower the vitamin D levels are. So winter months, and have you ever wondered why we get more colds and flus in the winter? Covering up, a lot of people are scared of the sun. They don't want that sun exposure, so they cover everything up. So if they do that, or if you do that, or apply sunscreens all the time, that's going to inhibit your body's ability to manufacture its own vitamin D3, and so you're going to need to take supplemental vitamin D at that point. Air pollution, so it's in direct proportion with the amount of pollution in the air. It's only found in a very few foods like fatty fish, egg yolks, cod liver oil. So that's why the importance of supplementation. You really can't get enough in your normal diet. People that have dark pigmented skin, in fact, fair-skinned people have 6 times the ability to manufacture vitamin D3 than darker pigmented individuals. Malabsorption, whether that's from general gut issues or changes with the microbiome, so there's absorption issues, or aging. Over time, as somebody ages, their ability to both manufacture and absorb vitamin D goes down. So for an elderly population, you want to be taking more vitamin D3. Statins will lower your vitamin D3 that's available. So, same with cortisol. Cortisol is your stress hormone. Obesity, and also people, as I mentioned previous, because of the conversion factors, kidney and liver is really important. So if somebody has kidney or liver issues, and they're not going to be able to do as good of a job with their vitamin D3.
There are many ways that your immune system is impacted by a vitamin D. And one of the things that vitamin D does is it stimulates your immune system. And it has these viral killing effects where it doesn't actually allow the virus to reproduce. It lowers the risk of respiratory infections. It decreases something called pro-inflammatory cytokines, which means that the inflammatory markers that are stimulated with reaction to certain kinds of things, vitamin D is able to suppress that. And at the same time, it's able to elevate the other things that inhibit these cytokines. Below we put 4 links, one from the British Medical Journal, 2 from the British Medical Journal, and a couple from the National Institute of Health, that really talks about the most recent studies and science and research that talks about the incredible importance of having adequate levels of vitamin D for your immunity.
Yeah. Okay, so a couple of things here. We know that vitamin D3 is critical for optimum bone health, maintaining a strong immune system, for arterial health, so that's cardiovascular. It's really important that you find a supplementation that is in the form of cholecalciferol, but also that it has K1 and K2 with it, because what that does is it prevents the vitamin D activating calcium, driving calcium into soft tissue and blood vessels, and if that happens, it causes elasticity changes in the blood vessels. So what are optimum levels? You want to be between 50 and 100 nanograms per deciliter. A lot of people, we know that 70 to 80% of the population is under 30 nanograms per deciliter. So it's an important blood test to have, see where you're at. If you're between 30 and 50, you're insufficient. If you're between 50 and 70, you're optimal. Now, if you have any kind of autoimmune health issues, cancer, heart disease, you want to be in the 70 to 100 range. But you want to measure it over time to make sure that you're not going too high, because it is a fat-soluble vitamin. And so you can develop toxicity over time. But for most people, that's not going to happen because they're so deficient right now. But it's good that you test that. Do you want to have anything to add?
The last thing is, if you are supplementing with vitamin D, remember that it is a fat-soluble vitamin. And so how your body can extract the most from it is if you take your supplement with having a meal with a bit of fat in it. So it needs to be in an environment of fat for your body to extract what it needs from that.
And maybe we should also just touch on, a lot of people say, oh, well, I see that my milk or my cereal or whatever, my crackers, are fortified with vitamin D. That's not in the form of vitamin D3. It's a synthetic form of vitamin D, and maybe you could tell them why that's a problem.
Yeah, so with synthetic vitamin D, which is, as Dr. Scott was saying, is added into a lot of the processed foods, that specific nutrient of vitamin D is completely extracted, and we never find it in nature like that. So an individual synthetic form is not something our body would ever find and utilize. And some people say that's actually very harmful to supplement your body with something like that. So you want to have it in a pure form as if you would find it in food. And that's what the D3 is, particularly when you have it with K1 and K2.
Yeah. If you like this video, please share it with friends, family, neighbors, and look for more of these videos coming your way soon.